Of focal pain around the radial head. He's limited in passive IR compared to the other side, and also radial. Can you show us the radial? You got to make sure for radial that you pronate all the way and then flex the wrist and flex the thumb. Do you feel that then?
Yeah, and you feel the pain over here and the tightness also.
Okay, and relax. So again, really want to make sure you depress the shoulder too. Depress the shoulder, then internally rotate, then extend their elbow and pronate, and then flex. Go ahead and flex. Yeah, do you feel that now?
Yeah.
Yeah, okay. So then what we chose to do instead of, the choices are either scraping along the path of the radial nerve or wrapping around the area where he feels the most threat. So go ahead and wrap this area here. See if you can wrap that. Much easier to wrap after you kind of rolled up the band.
True thing.
And actually, you can wrap him out of the kind of threatened position. So just take that off. Yeah, easier for you and also less threatening for him. So the goal here is really just to change the perception of stretch and threat that is felt at the radial head with some novel compression. And we're only really using just as much compression as needed to reduce the threat. It's not max compression, it's as little as possible. Because you don't want to create paresthesia or kind of cut off any kind of blood supply there. You can even just hold it if you can't. If you can, just hold it. Now just go ahead and retest that. So remember to depress the scapula too, inferiorly, full internal rotation, full pronation. Now, do you still feel it? Okay, he still feels it. This wasn't a good enough modulation to his threat and the perception of pain there. So we chose to wrap more proximally, which not only did that improve his IR. His IR is improved. So if his IR is improved, usually that means greater radial nerve mobility. So extend, full pronation, and then wrist and thumb flexion. Any pain?
No.
Okay, good. So again, if first I would choose clinically the area that is under most threats, but then choose an area. Technically, if he wasn't limited in pronation, it might have been a better choice to increase the area that had more limited mobility, even if you didn't perceive it up here. And I think that's why it worked, because now there's better radial nerve mobility.
Also,
yes, and